Hello everyone, I am Dr. Sharat Tandon. I am working as Director of Clinical and Preventive Cardiology at Medanta Heart Institute, Gurugram. First, I would like to tell you the topic for today's presentation is palpitations. Palpitations होते क्या हैं? You can feel your heartbeat and that is uncomfortable. That feeling is called as palpitations. The reason for palpitations can be many. Most of the time these are not scary, particularly when the heart structure is normal. The reasons are most commonly anxiety, stress, lack of sleep, some kind of depression. These are the things which are common factors in persons who have palpitations. But beside that, there are certain other very important reasons, like certain foods, like too much use of tea or coffee or alcohol. Persons who are taking certain drugs, particularly the persons who have some respiratory disorders, lung disorders, जो over counter medicines हैं, like medicines for cold and cough, they have certain elements called pseudoephedrine और terbutaline, aminophylline, dariphyllene. तो जो लोग इन मेडिसिन का यूज़ कर रहे हैं उनमें पैल्पिटेशंस ज़्यादा कॉमन होता है. बिसाइड दैट, पर्सनस जिनमें जो खून की कमी है, जैसे एनीमिक हैं या थायराइड डिसऑर्डर है, जिनको जो मेडिसिन ले रहे हैं थायराइड की, या जिनको हाइपरथायराइड कंडीशंस हैं, उनमें भी पैल्पिटेशंस बहुत कॉमन है. वेन एवर ए पर्सन ड्यूरिंग और बिफोर पैल्पिटेशन फील्स चेस्ट पेन, some breathing difficulty, or some kind of dizziness, blackout. Sometimes people may even fall unconscious. These are the times when the person should see their doctors, especially the cardiologist, urgently, because these may indicate the possibility of a threatening condition. The persons who are having palpitations in night, they most of the time their sleep is disturbed, and whenever the sleep is disturbed, in that case the morning time the pressures may rise, their heart rate may rise, they may have lack of focus, lack of concentration, their work efficiencies may go down. Regarding the lifestyle things which can lead to the palpitation, is one is very important, is smoking. A person who is smoking, their heart rate even at rest is high, and they may feel palpitations in the daytime, and particularly when they are off from their work, they are relaxing, they can feel their heartbeat, and which is quite uncomfortable. There are certain investigation which should be done in every case of palpitations, and the one is called as ECG, electrocardiogram, and 24 hours recording of this heart rhythm, which is called as Holter recording. The Holter recording tells us whether the heart rhythm is normal, it's their own rate which is gone up and causing palpitation, or they have abnormal kind of rhythms which is responsible for this palpitation. And then second test which should be done is echocardiogram, which tells us whether they have structurally normal heart, or their heart is abnormal in terms of their chambers are enlarged, their heart function is weak, their lower chambers are enlarged, or their heart output is inadequate. So in cases when the structural heart disease is not there, only the heart rate is gone up, these are the low risk group of persons. While the persons who have abnormal heart structure and their heart function is weak, or the chambers are enlarged, and they have abnormal rhythms, these are high risk group of persons. So these are the persons should be treated in a different way, while the persons with structural hearts, they don't require most of the time any specific treatment, and just reassurance and just anxiolytics or anti-stress medications, they help these persons a lot. Then there are certain investigations which should be done to find out the cause. Like there are certain conditions like persons who are anemic, or the persons who have thyroid disorders, they should get their hemogram as well as thyroid function tested. And if thyroid function disorders are a very important cause of palpitations,